This is Adrian Hart with your Southeast Colorado News on seconews.org, and we're talking about the Diamondback Classic with Brock Hinkhouse with Lahana Park and Rec. Now, the city's throwing this in combination with the Art Project and in conjunction with Early Settlers Day. So, bringing back the Diamondback. Tell us about it, Brock.
Well, you know, Zeke and I are about the same age. I think I'm older than Zeke.
Yeah, just a little bit.
Just a little bit.
Yeah.
We grew up I would guess around early 90s.
I believe so.
And right here on these courts had what was called the Diamondback Classic that Mike Sexton, the Parks and Rec director, put on.
Okay.
And it probably went for about 15 years and was really well attended.
Very popular.
And a lot of fun. We both played in it.
Yeah.
Heck yeah.
And I kind of in the back of my mind for a number of years was, you know, should we ever bring that back? And Zeke was coaching my kids' baseball team, and he's brought it up, and I'm like, heck yeah, man, let's do this again. And so we're working on bringing it back.
Throwback Diamondback 3-on-3 Classic. What more can you say? City of Lahana Art Project bringing it back. Let's do it.
Very cool. How do folks get registered to play?
We'll probably first week in August, so that's next week.
Yep.
I've got registration forms. We'll do it just like we do any of our youth registration. You can come in. I think we decided on $50 a team.
Yep.
Come in and register at City Hall. We're going to try and distribute it throughout the valley because back when it was going, I mean, we had people coming down from Pueblo playing in it, and you can just come in and register at City Hall, just like you would for your kids' youth volleyball program or whatever.
Very cool.
And yeah.
We'll get the information out there once it's officially available.
We'll have some flyers. We'll have a small commercial that you can partake in to get some information that'll be circulated around social media and everywhere as well too.
Yep. Yeah, we're going to beat this one up because we're bringing back the Diamondback.
Bring back the Diamondback.
Bring it back the Diamondback.
Yeah.
That's right. The classic Diamondback Classic. We'll get that out of our mouth a couple times. We have a special MC and announcer for that event. We haven't announced it yet, but we're going to be revealing that.
That's true.
And we'll be haggling him to come stand out here on the court with us and do an interview a little later. Yeah, very cool. Join us in September and get registered. We'll have the official link. Anything you guys want to add?
September 9th, be there.
Yeah.
That's pretty
excited.
much it.
Yeah.
Yeah.
I might even get a team together. Never know.
Yeah. Come help support Lahana Parks and Rec and the Art Project. With your Southeast Colorado news for Lahana Park and Rec and the Art Project 2023 from beautiful Lahana City Park, I'm Adrian Hart. This is Adrian Hart with your Southeast Colorado news on seconews.org. We're looking at the pile of melons here at Grady's Market, now open for the season. Just a half-mile west of Walmart on US Highway 50. Make your run to Grady's, get your melons, and much more. Scaff Brothers items available. And bins full of melons ready to go. Conveniently on US Highway 50. From Grady's Market with your Southeast Colorado news, I'm Adrian Hart. We're here with Jeff at the Opera House Pizzeria. Year number 2 starting tomorrow, right? So that celebration.
That's for year 1.
Yeah, completing year 1. Got through it. Time for that grand opening.
Yeah. In a lot of ways, it's like, instead of being excited for all of year 1, it was more like we got through year 1.
Exactly. I certainly understand that, having started my own business.
Yep. But it's time to celebrate.
Yeah.
Hello, I'm Andy Plummer. I'm the CEO of Arkansas Valley Regional Medical Center. Nice to meet you, Attorney General Weiser. Looking out on this room, I see a lot of people I've met in the last year. Hard to believe it's been a year. So, a lot of challenges, but a lot of successes, a lot of rewarding experiences serving as the CEO of Rural Critical Access Regional Medical Center. For many, almost the last year, we were the only OB program between here and Garden City, Kansas. Lamar finally got theirs reopened, and I'm glad. That community needs an OB program within an hour's drive of most of their population. We were glad to stand in there and help them out while we could, but we're glad that it's back open. Our biggest challenge is lack of adequate funding. We're 42% Colorado Medicaid. Colorado Medicaid only covers 40 to 45% of the cost to care for those patients. What business can be sustainable? 42% of your business is only covered 45% of the costs. Add in the chase payments, that helps some, but there's still a gap. So that's our biggest challenge. So I see Kristen Carpenter in the audience, and Kristen's helping me find grants. So we're not just complaining about it, we're also lobbying. And I spent a couple days up under the Gold Dome in Denver with my other 46 colleagues, CEOs of rural hospitals across the state. And we had a lot of successes legislation-wise. So we're seeking grant funding to make up that gap. But we really need the state legislature to step up and appropriate enough funds to cover at least the cost of care for the Medicaid patients in this state. And we see also every mental health patient comes through our radar at some point, usually in the worst state of their crisis. And our team does an awesome job, and we work together with all their agency colleagues at Valleywide, and law enforcement, and throughout the county and the cities. So it's a great team here, and a lot of support and teamwork. So I'm grateful for that. My wife and I love it here.
Where did you come from?
Surprise, Arizona. We still have a home down there. I have family down there. And I was most recently in Seattle as an interim CEO of a 160-bed hospital. We're a big national company. Talk about a nightmare. 50-bed ER. With a line out the door, a 6-bed mental health unit embedded within it. It's always full. 160 beds, those were all full. I had a medical gas oxygen system that was so old we couldn't find parts for it. The company and the system that owned us would not replace it. So I was glad to get out of there.
Well, we're glad to have you here. I'll say a few things about the funding. We fought to protect, and thankfully did, the Medicaid expansion. It'd be even worse if that hadn't. And we also worked with rural hospitals on a bill so that you could cooperate with one another to save costs, so that, again, the economics are a little less challenging than we know they are. So
thank you for the COPA bill.
No, happy to work with you on that.
And that's going to help all of the rural hospitals work together, where we were under threat of antitrust.
Their lawyers were scaring them, so we fixed it. Basically, they should be able to purchase goods through a buying consortium so they get a better deal. Just to give you one obvious example. Rick, who haven't we called on yet, Rick?
Well, I'm not sure, but I'm going to do a blatant plug real fast for Andy. Because I've been dealing with Andy for since he came, and he's done a great job. He's put this hospital financially stable. He's got his staff going great. He's trained them out and stuff, but he needs help. He talks about that. But what's one of the biggest problems? If you look at the stats of the people within Southeast Colorado, we're going to Pueblo Springs. Make this your first choice. Let's get our hospital back like it should be and what it was. And this man has done his part. We need to do our part. So every citizen out there, you look at Arkansas Valley Regional Medical Center before we go to Pueblo, okay? Let's start taking care of our own.
One gauge I use to judge whether we're having success there is we're getting a lot more compliments than complaints. So our quality scores have always been strong. We have great outcomes. And we're also getting surveying of our ER patients now to get facts out there that the patients are overall satisfied with their experience in the ER versus the negative naysayers that are got very loud voices out in the community. So I'm combating rumors with facts and data. And we always have room for improvement, and we know that. But we have a great team there, a lot of dedicated, experienced, long-term employees, and we're very fortunate to have such a wonderful medical center with so many talented, highly educated and trained and experienced healthcare providers. And I see the parking lot filling up more and more every day. And that's a great indicator. I know that sounds weird. I don't want anyone to have to be at the hospital, but if
better they're there than go to Pueblo.
please come to Arkansas Valley Regional Medical Center. We're there 24/7. Thank you.